Good afternoon and welcome to Let's Talk Hormones. It's Wednesday and it's noon. So you know what time that is. Time to just talk about all the little special things we need to do about menopause, and I want to be here to answer all your questions. So welcome to Let's Talk Hormones. I'm Dr. Gail Jackson. I'm board certified in Obstetrics and Gynecology in practice over 25 years, and I've transitioned into hormone balancing and weight loss and incontinence and management and everything to keep a woman over 45 fabulous. So if you're over 45, this is the few minutes this hour every week that you need to tune in and have a listen to us. So our specialty is menopause. That's all we talk about is menopause and everything else around menopause. So as you start calling in and checking in with me and tuning in, I want to answer some of your questions, because during the week I run into people who ask me questions, or people send us questions after the show, and I want to answer it. Well, yesterday I was at a really, really nice party, and someone asked me the question like that. She basically said, God, if I could just lose this 10 pounds. Well, we have the secret. First of all, if your testosterone is not balanced, you're not going to lose the weight, okay? So come on in, let's get your testosterone level. And yes, women do need testosterone. And we put you on the HCG diet, so if you're impatient as I am, you can lose minimally 10 pounds 2 weeks. I lost 11 in 2 weeks, and I've kept it off. So not only will we help you get it off, but we'll help you keep it off. So if you're getting ready to go on vacation and you want to put that little bikini on, or you just want to really feel more fabulous about yourself, and you have that last 10, you got this gotta go, come in, we have the answer. So this week's question is, what is the O shot? So as you tune in and listen to us, we want to talk about what the O shot is. Well, O shot is a trademarked term for what we do. Someone else trademarked it, and we're one of his, we believe in what he did. So what O shot is a way that we can use your natural cells to regenerate your tissue. So what do? We use PRP, or platelet-rich plasma. We draw your blood, we separate off the platelet-rich plasma, and once it's activated, it can be instilled in any part of the body to regenerate the cells. So orthopedics use it, have been using it. That's how Tiger healed his shoulder. That's how Kobe healed his knee and his Achilles. Well, when and where and how would a gynecologist use an O shot, and when do women who don't have orthopedic issues need O shots? Well, if you have the gotta-goes, you lose urine when you cough or sneeze, wear that little pee pad, or you dance when you're waiting to use the bathroom, then I think the O shot is for you. So if we lift the face with fillers and all the injectables, we lift the girls with the proper bras and implants and surgery and procedures and lasers, so why not lift the lady? So we call it the lady lift. The part of the O shot is enhancing the orgasm, which is why it's called O shot. So we take this PRP, which I previously talked about, and we inject it underneath the urethra, which is where the opening of the bladder, to improve bladder support. And ladies, it improves it by 80%. We're going to post some videos later to let some of our ladies who've had the O shot tell you how wonderfully, magnificently their lives have changed. So while we're down there, as women get older and they've had a little use, then we also can, and the lips of the vagina go, yeah, we can also pucker up those lips. And while we're there, we can put in the clitoris to enhance orgasms. And we can regenerate that tissue that from the years of sex, and also from the childbirth. So the O shot is a patented name for our term. We call it the lady lift. So we lift the face with fillers and lasers. We lift the girls. So we believe we should lift the ladies. So as questions come in, I'd like to ask you, the first question that came in is the O shot painful? Well, no, it's no more invasive than just getting your blood drawn for a lab test. Is it expensive? Ladies, call the office. And I'm sure the price tag is something that you will be quite happy with. And how long? The next question is, how long does the O shot last? Well, the O shot lasts up to 2 years. We have patients, ladies now that we performed the O shot about 1.5 years ago, and they're still experiencing fabulous results. So ladies, more questions are coming in. Yes, here they are. Okay, so how much do I have to take time off from work for the O shot? No. We basically, you come in, we put you in the room right here. It's no surgery, no OR, no surgical procedures. No operating room. Just simply in our office, in stirrups, we instill the PRP in those specific areas. And again, it's no more painful than just getting your blood drawn for a blood test. And you leave here and you go. And how soon does it work? Some ladies have experienced results just about immediately. But results will continue to improve over 12 weeks. So ladies, we always offer complimentary consultation. That means free. Love to have you come in, and we'd love to chat with you to help you with your issues with the gout-a-goes, losing urine with you cough or sneeze, or if you just want to pucker her up and make her pleasure perfect. Ladies, so thanks again. It's great to see you. It's great to hear from you. Continue to send your questions, and thanks again for tuning in for Let's Talk Hormones. We'll see you next Wednesday at noon. Until then, stay fabulous.